researchers say that digital COVID-19 vaccination certificates for use in some countries are available to buy on the dark web. Most appear to be fake, but others may be valid entries in national databases that have been leaked. Well, the Presidential Steering Committee on COVID-19 a month ago raised the alarm about a black market existing for illegal vaccination certificate procurement in the country. According to the chairman of the committee, no vaccination certificate illegally procured would scale scrutiny whenever the need arises, as all vaccination records have to be verified as authentic at every relevant point. Well, to talk more about fakes and talking, this is as regards certificates, COVID-19 test certificates. Joining us in the studio in Lagos is Mr. Kenneth Okolie. He's the Chief Executive Officer, Synlab, Nigeria. Thank you so much for joining us on the program.
Hi, good evening. Thank you.
Now, arriving passengers had complained that they were at the mercy of extortionists, and this was perhaps at the beginning of 2020 when COVID hit us, and everybody was pretty much struggling to put things in place so far. But recently, we've seen that some have complained. Some Nigerians boarding to major cities in Canada now complain that they were told they've stopped honoring PCR tests from Nigeria, and they were told to take tests, at the points, at the airports. They either had to take that test or the airline flies them back to where they were coming from, which is Nigeria. I mean, with all of this, what we're hearing, the claims, nobody is really certain about that particular case. But do you think that our COVID-19 test certificates is still going to the highest bidder, and that's if you haven't actually tested, you can get the certificate in Nigeria?
Okay, first of all, thank you for the opportunity to speak on this topic. I would not say that the COVID certificates are going to the highest bidder. Of course, I also am not naive to say that there are no individuals who are trying to, do some things here and there and coming up with certain things. But I would say in the last few months, the private sector and the government, when I mean the private sector, the accredited labs and the government have worked together to come up with some system. And I think the system has been in two phases. So the first phase was the fact when COVID started, there was a deluge of, manipulated results, and this led to a lot of trust issues. And I'm sure channels aired it, where there was a form of investigation by a UK journalist, and he came up with a lot of things, and that led to the government and the labs coming up with a 2D authentication of the report. So you notice that when you get your results from the private labs, it has a form of a 2D barcode, which needs to be scanned at the port of entry at the airport. And when it is scanned, it takes you back to a verifiable website for each laboratory. We noticed that had a bit of cracks here and there, and the government went a step further to improve its database. So currently, immediately results are ready. Each lab uploads the result onto the government's database, and at the port of entry, rather than the port officials just scanning your results, they can actually check on the government's database to see the veracity of your results. And that goes a long way, at least to restore trust and confidence with regards to the authenticity of the results coming from reputable labs. And I think that was a major issue we're having at the onset of COVID.
So if you have this sort of situation where they're saying that they weren't allowed to go with the test that they had done in Nigeria because they've stopped honoring what's coming from Nigeria, where do you put the blame? Who's responsible for this?
Now, a lot of times we say perception to a large extent becomes reality for some people. And I wouldn't take away the fact that a number of countries are making their decisions based on previous things that had happened, which we would not in any way deny that it didn't happen or did not happen. But I think it's important, and I know the government is doing a lot to educate a lot of these high commissions and all of that on the steps that has been taken by the government. So I think if many of them would take the step, okay, to really work with the Nigerian government, working with the Presidential Steering Committee, to see the steps that have been taken by the government, both in Abuja and Lagos, where are the major ports of travel, I'm sure a number of them would have to reconsider. And I know there's been a huge journey from 2020 up onto 2021, okay? So I think they would really do consider.
But would you say that it's possible to actually verify our certificates? Is there like a global accepted standard certificate that, you know, the world can actually use?
Okay, I think that is what we're trying to achieve with the vaccination cards. With the testing, no, there isn't a central database where you can verify. Every government has its own. So I think that it's a bit of a challenge, but well, nothing's impossible with tech. Okay, I'm sure with some smart tech guys, if we could link up some APIs and all of that across all the government's databases, I'm sure it will be possible to do. But as of today, it's a challenge which we need to live with. But I think every government and across the world, okay, all we need to do working with the private sector is to restore trust in the systems. And that goes a long way, okay, to give the receiving country the trust to accept whatever you're doing. Because everybody's scared. Nobody wants to admit more people with the risk of having people who have a virus coming into their country. Okay, so.
What are your expectations to massive testing, as much as we are really vaccinating, but to also test, especially with the new variants coming up?
Okay. With massive testing, well, I don't think it's, yes, it's the ideal, but it's not easy to get that done because at the end of the day, someone has to pay, okay? Yes, in the UK, you have the NHS taking care of it. In Nigeria, a lot of people are paying out of pocket. Healthcare in Nigeria is majorly out of pocket. We can't get the government to start footing that bill right now because there are loads of other projects that needs to be done. However, I would say to a large extent, if we all would simply do the basics, wear a mask, wash your hands, get vaccinated, get the booster dose if needed, I'm sure we'll be fine. But if you at any time are ill, okay, I think one of the very first things to do, okay, in any health center you go into, any hospital, is that you do a COVID test. But beyond that, I think we should just take all the precautionary measures.
We appreciate your time. Thank you so much, Mr. Kenneth Okolie, is the Chief Executive Officer, Synlab Nigeria. Thank you for joining us.
Thank you very much. I appreciate it.
Still to come on the program, South Africa's COVID PCR testing to go down by 40%. We have that story and more when we return.